Hello, and welcome to our fourth lecture of our Bruxism series. In this lecture, we will talk on the use of botulinum toxin for the management of bruxism. My name is Octavio, today's artificial intelligence-generated avatar. And in this short lecture, we will be reviewing common misconceptions about the use of botulinum toxin for the treatment of bruxism. This lecture was developed by Dr. Nicholas Scarmata, specialist in orofacial pain. Let's discuss some of the myths surrounding the use of botulinum toxin for bruxism and provide you with accurate information on this topic. What is botulinum toxin? Botulinum toxin is a neurotoxin that is derived from a bacteria called Clostridium botulinum, which is involved in botulism. This neurotoxin affects the muscle's neuromuscular junction's synaptic activity and sensitive and nociceptive nerve trafficking. Botulism is a rare but serious illness that can cause muscle weakness, paralysis, and even death. However, when used in small, controlled doses, botulinum toxin has therapeutic applications and is used for a variety of medical and cosmetic purposes. Botulinum toxin works by cleaving the SNAP25 proteins of the SNARE complex, which disrupts the exocytosis of acetylcholine. Acetylcholine is a neurotransmitter that plays a crucial role in the communication between nerve cells and muscles. By blocking the release of acetylcholine, botulinum toxin can effectively paralyze the muscles and reduce their activity. Despite the increasing use of botulinum toxin for managing bruxism by dentists and medical professionals, there is a lack of high-quality evidence to support its widespread use. Moreover, it's important to note that the use of botulinum toxin for the treatment of bruxism is considered off-label. Off-label use refers to the use of a medication for a purpose other than what it is approved for by regulatory agencies, such as the Food and Drugs Administration (FDA). The paucity of investigations researching the effectiveness of botulinum toxin in the treatment of bruxism is concerning, considering there is a lack of clinically accepted protocols, dosage standardization, and no prepared dilution specifically for bruxism. Most studies using subjective measurements showed an improvement in pain and jaw stiffness. In contrast, studies that have made instrumental evaluations often suggest that botulinum toxin injections do not reduce the number of episodes of sleep bruxism, but reduce the intensity of muscle activity in the jaw muscles, which is consistent with the idea that episodes of sleep bruxism are not induced by peripheral factors and have central pathogenesis. There is also conflicting evidence regarding if botulinum toxin is better to placebo injections like saline solution, with some studies finding that botulinum toxin is superior to saline solution and others showing there is no significant difference. Regarding botulinum toxin effectiveness in awake bruxism, there is only anecdotal evidence. However, this approach could be useful in severe awake bruxism cases. It's important to be aware of the potential health complications that can arise from botulinum toxin injections for the treatment of bruxism, particularly when high doses are used. High doses of botulinum toxin can lead to a range of issues, including jaw weakness, changes in bone density and volume, and muscular and skeletal toxicity. Additionally, facial paralysis can occur as a common complication when injections are not performed with caution, potentially affecting the facial muscles. Lastly, it's important to discuss the risks and benefits of botulinum toxin injections with your healthcare professional if you're considering this treatment for bruxism. Additionally, the effects of botulinum toxin injections are temporary and may require repeat injections to maintain the desired effect. In summary, while botulinum toxin injections for the treatment of bruxism may hold promise, further research is needed to determine their safety and effectiveness. If you're considering botulinum toxin injections for bruxism, it's important to discuss the potential risks and benefits of this treatment with your healthcare provider. They can help you make an informed decision based on your individual needs and medical history. Thank you for watching this medical lecture on bruxism and botulinum toxin, the facts and common misconceptions on its application. If you have any questions or comments, please feel free to leave them in the comments section below, and we'll be happy to respond. If you like our content and want to continue learning about different medical topics, please subscribe.